Let's talk more about your injury prevention efforts. You've had a very simple message that you've been advocating for more than a decade, at least for as long as I've known you. It's prevalent in all of your interviews with the media, in your discussions with politicians, and it's the underlying theme in all your presentations to corporations and organizations. Remind us again of that message and about the perspective that most of us fail to see.
Well, the important thing is that injuries are not accidents. People have to understand that these events are predictable and they're very preventable as well. And there are strategies in place to prevent all injuries from occurring through either a combination of education, engineering strategies, enforcement strategies, or economic incentives or disincentives. So we know the tools to prevent these injuries from occurring. And in the event that these injuries occur, we have to make sure that we have good systems in place, from first responder to EMS to our emergency rooms, our trauma facilities, our intensive care units, our trauma wards, and then our rehabilitation facilities. So if we're able to put those together and they work well, then we have an injury control system. And within that injury control system, prevention is probably the most important component. And the reason is that close to 60% of all trauma injury-related deaths occur right at the scene of the event. And so all the doctors, nurses, and helicopters in the world would make no difference for that individual because they die as a result of their injury. And so the only cure for that would be its prevention. And so the message is simple. Injuries are not accidents. They're not freak accidents. They're events that we know occur, whether they occur on our roadways, at home, at play, at work, and we know how to prevent them. And so if people can believe that injury is a disease, then we can, move forward collectively and put the efforts that are going to be required into eliminating this disease, as other countries have done quite successfully.
And that has to be one of the toughest parts of what you do is reprogramming our minds to believe that injuries are not accidents. Every night on the news, we hear about a different fatality or traffic crash or some atrocity where it is termed accident. And that's something that I've grown up with and continue to hear on a daily basis.
And that's the biggest challenge is if it bleeds, it leads. So there's no shortage of media coverage of these events. And so the media has conditioned our population into thinking that it's normal to have all these things happen. And so whether they're intentional or unintentional, these injuries do not have to happen. And people have to believe that. And once people believe that, then you can move towards solutions. So the biggest problem is moving towards solutions too quickly before you set the stage for what the issue actually is.
That message is the focus of your talks to corporations and organizations. And working with you, I get to see the effect that your message and perspectives have on the audience. In fact, I've never seen anything like it. Tell us about your presentation and its components and how you managed to hit so close to home with every member of the audience.
Well, I think that's actually quite simple. What we've done over the years is given thousands of these presentations and listened to the questions that people are asking and reading the evaluations, and by taking the best elements of all the previous presentations and combining them into a new presentation whose focus is to acknowledge that life is complicated and maybe people are getting injured because they're distracted by so many different things going on in their lives, and acknowledging that right early in the presentation, that I think we've struck a chord with most audiences. And lately, the evaluations are telling us that the message is ringing true with the audience. And it doesn't matter what the audience is. As long as there's humans in the audience that have real life issues going on a day-to-day basis, we can tap into that and say, hey, listen, it's okay to be distracted. It's okay to be distressed. But here's what you have to do to get things back on track, not only within your life, but within your corporate life as well. And by doing so, what we've been able to do is find a message that works for just about every audience, every different age group, and people leave inspired going, well, I think I can do better, and now I know why I'm feeling the way I'm feeling. And we touch on topics that are quite sensitive and quite powerful. Fatigue, substance abuse, mental illness. These are issues that people don't usually feel comfortable talking about. But if you can present it in a way and, add a little bit of humor as you're going along, people are able to laugh at themselves and, laugh at the presenter and say, I think we're on to something here. We want more. And that we want more is why we've been asked to develop a program for, a few select organizations to be able to continue to mentor them as they start on this journey, or they continue this journey that they've started, and they just need a little bit of mentoring from someone on the outside.
You recently did a talk for a large number of individuals in Saskatchewan, and you received some survey feedback that I think is very powerful. One individual commented that you're saying what everybody is thinking, and I take from that there are some things going on that we're all thinking about but are afraid to say anything, or maybe it's because we're not qualified to say anything. How do you respond to a feedback item like that?
Well, I think that's rather encouraging, because what I try and do is take my experiences in day-to-day life, both in the emergency room, at the university, and on various boards, and comment on what I'm seeing occurring that shouldn't be happening. And I'm at the stage in my life where I really, can say what I'm thinking. I don't have to worry about getting into medical school. I don't have to worry about, getting kicked out of my job. I don't have the worries that a lot of people may have. And so I just tell it the way it is. And as long as you don't lie and tell things truthfully, it's amazing how the truth, sets a lot of people free. And if it empowers others to be bold, then so be it. But I haven't said anything that I, would regret saying. And it's meant to challenge people. And I think we've been able to find the right balance between being respectful but challenging individuals as well.
It's funny, in the course of our professions and even personal lives, we attend seminars and hear people speak. Personally, I've sat through more seminars than I can count, but it is such a rare occasion to be part of a session where the speaker, without any room for argument, really knows his stuff. I mean, not only do you have the knowledge and experience your taboo topics demand, you are the guy who we see in the emergency room when we cross the line and get injured. Has anyone ever challenged your position?
Oh, I constantly ask people to challenge it, because by challenging it, what we can do is explore at a higher level of thinking ideas that will hopefully crystallize within their mind. So I love audiences, and I usually try and end with as many questions as I can, especially in rapid fire, where people just give out as many questions as they can about either things I've said or things they've thought about, and then we take it to the next level, and that's the best part of any presentation. So I absolutely love being challenged, because everything I say, as I said, is based on truth and experience, and so it's very easy to cite references for just about everything that I say. So I find it actually quite boring to do a presentation and get no questions whatsoever. But those are rare events.
So we spend in excess of 40 hours per week working to earn a living. We put our kids in daycare or school and spend a majority of our daylight hours working as office administrators, engineers, machinery operators, salesmen, technicians, managers, or even oil field workers. How can your message and solutions work for such a wide variety of people?
Because people have the same pressures in their life. And as long as you can, acknowledge that it really doesn't matter where you are within the corporate world, you still may have a child who's into drugs. You still may have financial problems. You still may have health-related issues, or issues of your parents, or housing issues, or loneliness issues. These are things that we all feel, and to different degrees. So my challenge with a diverse audience is to meet the needs of the different generations within the audience, but to acknowledge that what they're feeling is perfectly normal, and to then try and empower them to take better control over their own lives, and the most important part being their personal well-being. And so we spend a lot of time talking about what makes us healthy and what keeps us healthy. And then we talk about the problem of injury and the distractions within our lives that most likely contribute to injuries taking place not only amongst ourselves, our co-workers, and our family and friends as well.
Like all audience members, I left your presentation wanting more. I wanted to bring your message home to my family and friends. What can people do to continue their journey with you and have others experience your perspectives?
Well, we're getting a lot of requests for that, and so we're redesigning the website to make it more interactive and to give people an opportunity to, read some of the things we're writing or listen to some of our audiobooks or take a look at some of the slides we're using and the reasoning behind it. And for, companies that really want to take the next step, we're going to have an opportunity for a limited number of companies, because it takes a lot of time, to come on and serve as a mentor to them in our corporate excellence program. So there's plenty of opportunities for people to get involved. Probably the most important one is to visit the website and get a good understanding of what we're trying to do to help individuals and organizations as well.
So let's put it all together. You've described in your presentations and to some degree in this discussion what we need to do to maintain or improve our own physical and mental health. But just to be sure your words are clearly heard, Lou, what is the problem and what are we as a society doing wrong?
Well, we've got to focus on what keeps us healthy. And what keeps us healthy is not the healthcare system. So we've got to get down to the basics and understand that social determinants of health contribute far more to your health than any healthcare system. And the social determinants are education, income, social status, housing, nutrition, social engagement, social cohesion, hope, resiliency. These are issues that are obvious, but for a lot of people, most people haven't realized that these are the things that keep us very healthy. The other thing is, if you look at the most immediate needs for organizations, is how to deal with the injury issue, their injury problem, and reduce these incidents. So we at least start talking about the notion that safety culture actually exists and can be measured within an organization, so that they know where they are in terms of where they should start working on the issue. And then afterwards, what happens is that once you get the safety culture measured within an organization, you can start developing programs that are very specific to that organization and focusing on areas that normally are not addressed. And the three biggest areas right now that we have presentations on are fatigue, substance abuse, and mental illness, because fatigue, substance abuse, and mental illness are directly related to injury events within an organization. And so, as uncomfortable as it is, organizations have to be able to address those three issues and understand that they play an important role in the company's bottom line.
So I need to ask a very obvious question. Is it too much to ask for busy people to change their perspectives and make necessary changes to better themselves?
It's not too much to ask. It's the only thing to ask, because at the end of the day, if you don't make the changes, you're not going to get the level of satisfaction that you could be getting out of your life. And life goes by very quickly, and it's unfortunate that some people take 20 years to realize that some simple changes could have improved their lot in life and the lot of their family and their organization quite significantly. So I think what we're doing is common sense. I think the humanity of it all has distilled the most basic elements that an organization needs to hear in 90 minutes or so. And then the most important thing is to make sure that they continue to follow up afterwards.
And given all that, how would one know that what they're doing is working?
They'll know if they're measuring. So if an organization is trying to change the safety culture, then they will have measured where they were at and will measure and see that the changes are quite significant. But probably the most important thing is companies notice it right away in their bottom line. They become more profitable because people are less likely to be missing work. People are less likely to be making mistakes that have to be repeated. There's a higher satisfaction with the job. There's less turnover within the job. There's less strife and turmoil within the job. And people are generally happier. Happier people are less likely to use, healthcare benefits, are less likely to be a drain on the company as opposed to being a positive, productive contributor to the organization. So people know it quite quickly. You don't have to reduce too many injuries to see the impact on the bottom line.
So what plans do you have in the future in terms of getting your message out there and helping people see things for what they really are?
Well, I think what we're going to do is continue to develop podcasts and audiobooks and expand the website and make the presentations more readily available to a diverse audience and coach them and mentor them as they continue to grow and use that feedback to better the program constantly.